everyone, this is going to be a pretty quick lesson going over the diagnosis of intussusception. So that's a really difficult word to say sometimes, intussusception, but it's actually a pretty straightforward diagnosis. So let's get started. Okay, so intussusception is when the bowel telescopes into itself, and you can actually see in the photo here what that looks like. Now, this diagnosis usually presents between kids who are between 6 months and 3 years of age. So that's the age range that you want to be aware of that this can actually occur. It's very, very rarely seen outside that age range. Now, intussusception becomes a problem for these kids because what happens is that the bowel can become obstructed and you start to lose blood supply to this area. Now, this can lead to all kinds of complications. So it can lead to perforation, which can then lead to peritonitis. So you've got inflammation and infection in the entire abdomen, which then leads to sepsis. And like I said, that bowel here is at risk for dying completely. So kids who have intussusception need emergency medical care and surgical intervention. So it's super important that we not miss these signs and symptoms that are associated with this. And that's what we're going to talk about next. Okay, so what are we looking for with this diagnosis? Well, the first thing that probably stands out is that they're going to talk about having blood in their stool. And this blood is described as being bright red or like red currant jelly. And parents will often find this in the diaper, and they might actually even bring that diaper into the emergency room to kind of show you what they've observed. And so it's really important that we're paying attention to these kids' stools. And one reason for that is that if we note a change in their stool, so it stops being red currant and we notice that they have a brown stool, this actually means that the intussusception has self-resolved, which is great because it means they may not have to go to have surgery. So definitely don't just go by what the parents said that one time with the blood. We want to make sure that we're looking at this child's stools throughout their entire hospitalization. Now, the next thing to note for your assessment is that these kids have kind of a specific type of abdominal pain. And so what you're going to see is that they have this cyclical pain. And all that means is that the pain is coming and going. And so they'll have these really intense moments of pain where they're drawing their knees to their chest, they're screaming, they're in so much pain, and then it kind of stops and they seem to have relief for a bit. So definitely look out for that pattern when you're talking to families about how their child is feeling. They may also experience nausea and vomiting, and just always remember if we hear or see green bile, we know that this could indicate an intestinal obstruction. If you palpate this child's abdomen, you're probably going to feel a sausage-shaped mass wherever that intussusception or that telescoping has occurred. Now remember, the real concern here is that this intussusception could cause obstruction, which leads to perforation and then to peritonitis. So it's really important to be aware of those signs of peritonitis. And the ones that you want to keep in mind are they could have a sudden fever, nausea and vomiting. They may have abdominal distension. These kids are going to be rigidly guarding their abdomen. And the important thing to know about that is that kids can become really protective of their stomach. They may not want you to come anywhere near it. They may be lying in bed very still and motionless, protecting it because it's so painful. So that's a really important sign of peritonitis in children. Other things to be aware of is you can see vital sign changes like an increased respiratory rate, increased heart rate, and then as their condition deteriorates, you can also see their level of consciousness decrease. Okay, so if we suspect a child has intussusception, they are going to go down to the radiology department, and they're probably going to do either a water, air, or a barium enema. And this is going to allow them to have a look at the bowel and see what's going on. Now, what's great about this is that we have a situation where what we're using to diagnose the problem may actually be able to cure it. So the first option for taking care of this intussusception is a hydrostatic enema. And what happens is the pressure that's created when they're doing this procedure can actually cause that intussusception to resolve. And this is actually successful 65 to 75% of the time, which is great because it's so much less invasive than actual abdominal surgery. But if it doesn't work, they are going to have to go into surgery to have that bowel repaired. Your nursing care for this patient is just going to be really similar to any patient that's had an abdominal procedure. So this links into things that we've talked about in the lesson on appendicitis in children, and it also links into some of the adult information that you know about abdominal surgery. So again, we're primarily monitoring bowel function. We're going to be providing wound care. They're going to need IV fluids and pain management. So definitely link all that you already know about that into this topic about intussusception. Your priority nursing concepts for a PEDS patient with intussusception are gastrointestinal and liver metabolism, elimination, and infection control. Okay, so let's go over the main things that you need to know from this lesson about intussusception. So the first thing is just knowing that intussusception simply means that the bowel has telescoped into itself, and we're really looking for this diagnosis in kids who are less than 3 years of age. Now, the primary symptom that you're going to be seeing with this is that you may see that they have red currant jelly blood in their stool. Now, remember, we're assessing that stool always because we want to see if it returns to normal, because if it returns to a normal brown stool, this means that it's maybe resolved itself and we don't have to do surgery. Our primary concerns with intussusception are that it can lead to bowel obstruction and peritonitis. And so we've got to be on the lookout for symptoms of those problems like green bilious vomiting, fever, and abdominal distension. So our first attempt at treatment is going to be through a hydrostatic enema. Remember, that's diagnostic and potentially curative. And if this doesn't work, they are going to need to go to surgery to have that fixed. And guys, your post-op care is going to look a lot like any other abdominal surgery that you would provide. So we're monitoring bowel function, assessing for infection, and providing that wound care that they need. All right, you guys, that's it for our lesson on intussusception. Like I said, it's difficult to say, but it's very straightforward. So make sure you check out all of the really great resources that we have attached to this lesson. Now, guys, go out and be your best self today. And as always, happy nursing.